We're living in a time where lifestyle conditions and chronic disease, such as diabetes and obesity and heart problems, they're putting a huge strain on the healthcare system and making it really difficult for a lot of people suffering around the world. There's this great opportunity and responsibility for technologies like remote patient monitoring to help give better visibility, greater insights, and outcomes for both patients and hospitals. Well, with me today on the show is Vidya Nallamad from NetHealth, who are helping integrate clinical information for a comprehensive view of patients' health. In this episode, I speak to Vidya about what's happened with NetHealth since the last time we spoke on the podcast. We hear some humble reflections from Vidya about the challenges of being a health tech startup and a female founder, and also the opportunities to solve real-world problems for many patients, not just here, but across the world. Collaboration starts with a conversation. Team HealthTech, let's make it happen. This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare. Hey Vidya, how you going?
Good, thanks, Peter. How are you?
Good. It's been a while since we've had you on the podcast. I know we had you appeared in an episode probably about 12 months ago as part of even maybe 6 months ago with the Australian Healthcare Week last year. And we released an episode a while after that event happened. But you did do an episode a few years ago, I think, where we kind of did a bit more of a deep dive into NetHealth and the work you're doing and all of that. But been a while between conversations. How you been?
Oh, good. Actually, great. I should say, lots of things have happened since the last time we spoke. I think it's been a year or more than that, I suppose. Yeah, NetHealth has got much more traction in the market. Lots of hospitals who have taken up the platform and we have kind of nailed or channeled to which market we want to cater. So lots of things happening at our end and excited to be talking about it today.
Well, look, they're good problems to solve in terms of finding those, the area that you're operating in, the ideal customers and getting that traction. But for obviously people can go back and learn and do a bit of a deep dive into NetHealth. But for those that are listening right now that may not be totally familiar, talking about NetHealth, what it is and the space that you're operating in.
Absolutely. Yeah. So, NetHealth is online remote patient monitoring software, primarily providing patient care for people with lifestyle conditions. I say that as lifestyle because we are operating in now people with diabetes, heart problem, obesity. Those are the kind of problems. Through our remote patient monitoring software platform, we are able to help them get back to their life, lead the life that improve their quality of life. That's our main focus. But as much as we want to conquer the world, but we got to start from somewhere, right? So we started with diabetes and focused further into pregnant women with diabetes. That's have been our focus. And we wanted to give back to the community wherein an unborn child has to have a healthy start, both for the unborn child and for the mother. So that's where we have been. And NetHealth is a software platform which is TGA approved and being currently used in more than 25 hospitals across Australia. And we have that wing of giving back to the community. So we have a hospital in Kenya where this is being used. And that's so fulfilling to go to those remote places and provide the software to the woman there.
I didn't know that one. I didn't know the Kenya thing. That's really cool.
It's been amazing and lots of learnings from that whole project that we're still doing, but till date.
That's really interesting for so many reasons. Obviously, first and foremost, the fact that the platform can be, repurposed out to benefit people in areas that have all new sorts of challenges and arguably much more so than us here in Australia in terms of healthcare, chronic disease management in particular. But also, I guess if you really get that right, that then's a demonstration of scaling the platform out broadly too. And if you can, while in that process, help a lot more people, I mean, everyone wins.
Absolutely. And this shows that software doesn't need to be bound by, geographical location. If it's done right, it can go across so many people. And in Kenya, what we really found was the receptive attitude and the ability for women and families to accept and adopt this change. And they're so mindful. They know that they need something like this for their child. If you tell, oh, you'll be fine, that doesn't cut the chase. But if you say your baby is going to be healthy, it's kind of a new dimension it provides. It was kind of interesting to get lots of insights into it. We just think that developing or underdeveloped countries may not have access, but they have access to lots of technology and they are much more technically savvy than we think that we are or they are.
That's really interesting. That's a fascinating space. Just to go back one too, because you mentioned, it sounds like customers primarily are the hospitals, like the software's being installed at a hospital setting, but it sounds like you're very focused on patient outcomes. So it's not a patient facing application. It's something used within hospitals to enable those patient outcomes. Is that right?
Yeah, so we have both. We have a patient facing mobile app that the patients use on their current mobile applications. And also, we have the clinic facing. So we have the clinician portal that they can log in. And we have done the integration so that the data goes into your existing hospital system. We know how much clinicians hate to have multiple software. So we have integrated with their health hospital management system so that they have just one entity. So we have done both ways, and our main focus, as you rightly pointed out here, is patient outcome as well as health economics for the hospital health service, as in how much time can we help the clinicians save. We are not compromising on the patient care. That's the main focus. We are not compromising, but if there's a way that we can help clinicians get back some time so that the risk patients get some more extra benefit out of their clinician time, that's where we want to make this as a whole experience for both hospital and the patients.
Yeah. Like we said, it's been a while since we last spoke on the podcast, and you've been doing this for quite a while. And we'll talk about being a startup in Australia in a second and that whole journey. But you must have now at least some good reference sites or a demonstration or some data to show that this thing is actually effective.
Yes, absolutely. Yeah, we have published peer-reviewed research papers that's available, and we've shown, at least this was 3 years back, but if we extrapolate the inflation and things like that, we are saving on an average almost about 45 to 50 minutes of clinician time per patient. That's a lot of time that can be saved, and this is per patient. And this is not to say we are compromising on any patient care, uh, giving the best quality care, but yet we are saving clinicians' time as well as close to about 30 to 45 minutes of patient time, the whole journey they need to take, make it to hospital, to that particular appointment time, all those. Uh, and they love it, the fact that they're accessing the clinician. So those are some of the health economics we were able to deduce. But yeah, lots of research coming.
Yeah, there's always nuance there. But that's really interesting, nearly an hour's worth of time back per patient for a clinician. And, a patient obviously doesn't sit down an hour at a time with a clinician. So is this part of the problem that you're solving? The fact that for a patient with a chronic illness or some kind of need that requires multiple providers or disciplines and visits, I imagine there's a lot of inefficiencies in that whole back and forth that utilizing your platform would start to claw back
Absolutely.
some of that time.
Yeah, absolutely. Yeah, because having that multidisciplinary clinician care into one particular patient has actually resolved a lot of issues. One of them is Again, I'd go back to diabetes management. You need the dietitian, educators, endocrinologists, quite a few people involved in providing that care. And, even if we have the same source of information, that makes so much easier for the clinicians to start from where they stopped previously. If dietitian has provided some advice, the endocrinologist or the specialist can see what they have and take it forward from there rather than, hey, let's start. Where did we start 3 months ago? You're not wasting time with that kind of catch up conversation, is what I say. So I think that's been the benefit out of using the platform, having a single source of truth or information.
I imagine that single source of truth too would come in handy for other stakeholders involved in that patient journey, particularly I imagine, well, for anyone with a chronic illness, often carers are just as important in the journey and sometimes need more information than what the actual patient does because depending on the demographic of the patient. So I imagine you've kind of worked that into your platform too.
Absolutely, yeah. The carers could be anyone from their family, or even a person or a patient's family could be living, say, 7,000 kilometers away, like how it happened to me. So they are able to still see what's happening with their family or whoever they're providing the care to, and catch up on their health. So that's being taken care of, that empathy, the emotion side, the family, the carer, and the clinical side. So we have this entire entity working with the patient.
And being a startup, something that you've built up out of your own personal experience, and then get to this point, which I'm going to hazard a guess and say that wasn't entirely where you expected it would end up from that point until now. But what's that journey like been up until this point, at least, in terms of being a startup in the health tech ecosystem in Australia?
Oh, that's a really good aspect I'd love to talk about. It's been a really fulfilling and still learning this whole journey as we go one step at a time. Uh, but scaling or starting in Australia has been amazing. The whole ecosystem, the mentors, all those people who have supported, they have been really amazing. But one aspect for any health tech startup business is patience. We need to have patience, and we need to be in for a very long run for this.
Patience with a CE, not patience with a TS. Is that what you mean?
That's correct.
Right.
Yes. Absolutely. Yeah, that's with the C there. Because in health tech industry, there is that confidence and the brand presence, which makes it very essential for, I know, even for hospitals to adopt. So it's very hard for a hospital to embrace a new technology from a startup company, for example. Not many hospitals are open to working with startups. They have their own mindset of regulatory compliance, all those. But if we can show as a startup we tick all those boxes, definitely there is. But there's always a big fight that you need to have with these big established brands that you need to make a mark. We need to show as startups or scale up companies always that we are in for change. We can make those change, adapt, customize according to their requirements as opposed to the big brands.
There are many benefits of working with a startup compared to a less nimble organization. And it's something that I think, procurement teams within healthcare settings, I would hope are starting to broaden out that thinking and not being complacent in the thinking of, well, if it's a big company, it must be fine. And that's the safe option here. However, with the big complex system comes usually a lack of, direct customizability or really speaking to the problem to be solved. No matter how big the organization is, in the end, if it's not aligned with the values of the company that it's serving, directly, or doesn't really get it. And
That's
also,
right.
I see it so many times that startups sometimes can get it much more than the very big organizations because there's that human kind of
Touch.
element.
Yeah, there is that human side of things. And I completely agree. Yeah, the aspect of not being nimble by the corporates or bigger entities. I think that's what sets a scaling company apart. We are much more there for them and provide what they need to work in a way that they need to work. Uh, and that's what hospitals or any health service need to understand uh, and encourage, I suppose. Not all of them, but there are most of the hospitals, because we have expanded into more than 25 now. So there are lots of them, lots of hospitals who are open to working with scaling as long as you tick those usual boxes. But yeah, I think that's the message you rightly pointed out, Vidya.
Well, and on that too, about ticking the boxes, you mentioned about concerns around regulatory and all this kind of stuff. Maybe 10 years ago, 5 years ago, there weren't many startups in inverted commas that would have the capability to, meet the minimum regulatory requirements. These days, more so, it's a totally separate conversation about, the ongoing challenges for startups and
I
changes
know.
with regulation, but let's not totally derail
No.
this conversation.
No, I completely understand where you're going.
Yeah,
from.
yeah. From a software vendor at heart, I feel that on a day to day. But it's something that there is the message, I guess, the take home message for that procurement teams is that and I feel like they know it more and more now, is that the startup ecosystem is thriving. It will continue to thrive in the health space, but needs more of that confidence and backing to really help it get to the next level. And it'd be great to have more business from in Australia too.
Absolutely. Yeah, no, that's, you've hit the nail on the head. So yeah, absolutely. That would be nice to have more acceptability for software companies and startups, especially in the health tech space.
And so for Net Health, what you're focusing on this year, continuing to service those hospitals that are already in the camp and no doubt looking to expand further. Is that the priority this year?
Yeah, and we are looking at overseas market as well, Pete. So as I've mentioned before, Kenya, yes, absolutely. But we are looking at our sister country, New Zealand, and a few other overseas countries where we can expand and provide this service, uh, primarily focusing on the pregnant women, but nonetheless expanding in the diabetes area.
Yeah. On that point too about, I guess say niching down into the pregnancy or diabetes or pregnancy and diabetes
Yeah.
together, that itself in a strategy is arguably quite sound, and then looking to scale that out globally as opposed to trying to then broaden out into other not the saying that's a wrong strategy. It's just you know I imagine you spend a lot of time thinking about the two different angles that you could go down, and arguably you could do both, but as a startup, sometimes you can only
Do
have
so
one
much.
do
Yeah.
so much. So how do you think about, like, put me in the mind of like going down one path or the other, in terms of that decision to really stick with the pregnancy and diabetes? Why is that important?
Yeah, because as I said, our values are giving back to the community, a healthy community. So we want to start from that early journey of pregnancy. And the fact that anything to related with the unborn child, you have that buy-in from the family, from the end user. Yes, I think I need to get myself healthy. Uh, I'm not saying, the older cohort are not very receptive. They want to stay healthy, but the adaptability from these ladies, the family, is much more crucial. So we find there is a market, we have that business model working. I think it makes sense to make our mark in this particular area. Then we'll see how we can conquer the world.
But I think you hit the nail on the head right at the start there in terms of alignment with values, because in the end, that's what you say. When there's a challenging decision to make where either seem like both the right or the wrong answer, so what do you decide? In the end, if you can tie the decision back to, the values of the organization, the problems that you're trying to solve in the first place, even in the bigger picture, and you've identified that, and then identified the cohort of people who are most receptive to that, and then you can broaden out from there. So that gives you that flexibility to be able to broaden out as the resources are there. But no doubt there'll be plenty of others within the THT Plus community and our broader audience who'll be keen to chat with you more about your experiences, Vidya. So we'll put your details in the show notes of the episode, And no doubt we'll connect again on whether it's another summit this year or again on the podcast soon. I really appreciate you making the time, and good luck with it all.
Thank you so much. Thanks for the opportunity, and we'll talk to you soon then.
For more content and community about technology and healthcare, visit talkinghealthtech.com.